Can your depression be cured? Can you fully recover from depression? In this video, I'll be talking about recovery from depression and how you can increase your chance of attaining this. If you broke your ankle, your doctor can pretty much give you a reasonable estimate of how long it will take your bones to heal. This is, however, not the case with depression. The timeline for depression recovery is somewhat tricky because everyone is different. Depression is a chronic illness, but studies show that recovery is possible. This, however, depends on many factors, including whether your depression is of new onset or whether you've had depression for several years. A study of people who were newly diagnosed with depression found that the average length of time people felt depressed was 3 months. This study showed that about 50% of people recover from depression within 3 months, and 76% recover within 12 months. About 20% of people do not recover even after 24 months. The symptoms of depression can improve even without treatment, but this again depends on several factors, including the type of depression and how severe it is. Even though some people may recover from depression without treatment, in many cases depression worsens without treatment. Options to treat depression include medications, counseling, transcranial magnetic stimulation (TMS), esketamine, and ECT. There are slight differences in the recovery duration depending on the type of depression you have. Depression can present in different forms, including major depressive disorder, postpartum depression, seasonal affective disorder, persistent depressive disorder, and depression from bipolar disorder. We'll talk about this in a later video. Other factors that can affect how long it takes for you to recover from depression include the severity of your depression, having psychosis with depression, personality disorders, and severe anxiety. All of these factors make it more likely that your depression will be more prolonged. Regarding the severity of depression, this can be mild, moderate, or severe. If you have mild depression, this means your symptoms may be less intense and may also last a shorter time, as compared to if it was moderate or severe. While some people experience depression only once in their lives, others may have several episodes of depression. A study showed that about 50% of people who have an episode of major depressive disorder will have a second one, and about 80% of people who have 2 episodes will have a third one. If you have had just 1 episode of depression and recovered, the longer you stay without a second episode, the greater your chance of not having another episode. As an example, let's take someone with a genetic predisposition to depression who lost a job and had to relocate to a new town. If she ends up having depression, her job loss, financial issues, and social isolation could potentially make her depression more severe and last longer. Let's say she recovers from her depression and her overall situation improves. She gets a new job, makes new friends, and settles into her new town. Suppose she goes by for several months or years without another episode of depression. In that case, it may well be that her depressive episode was just a one-off. Of course, there is always the possibility of a relapse in the future. The chances of having another episode of depression increase if your first episode was very severe, if you have had several episodes of depression, or if you had depression very early in life. When your depression improves, your symptoms may become insignificant or go away completely. This is what we know as recovery or remission, and this can last months or even years. There are 2 types of remission: partial remission and full remission. In partial remission, you may have some of the symptoms of depression, but you don't meet the full criteria for depression. In some cases, you may have no significant symptoms of depression for a period lasting less than 2 months. This is also partial remission. On the other hand, full remission means you have not had any significant signs or symptoms of depression in 2 months or more. So how many people with depression go into full remission? A notable study to look at is the STAR*D trial. This is a large and highly significant study in psychiatry. The STAR*D trial highlighted quite a few important facts, including how many people achieved remission from taking antidepressants. The study trial showed that the remission rate was only 33%, which means only about 1/3 of the people with depression had no significant signs or symptoms for 2 months or more. I'm sure you'd agree with me that 33% sounds disheartening. However, a study of people with depression showed that more than 80% of people who get treatment say it helps. If you stick with it, the odds are that you will feel better. It is for this reason that you want to do everything you can to manage your depression and ensure you achieve remission. Treatment of depression involves a biopsychosocial approach. This involves medications, therapy, and addressing life issues that could be making your depression worse. Medications and psychotherapy are the most talked about forms of treatment for depression. Other forms of treatment like TMS, ECT, and esketamine are also beneficial. For optimum treatment and response, it is crucial to consider a more encompassing or holistic approach to depression treatment. This is where lifestyle medicine plays a huge role. The 6 tenets of lifestyle medicine are nutrition, exercise, sleep, stress management, avoiding substance use, and social connectedness. These, in combination with medications and therapy, can play an immense role in helping you achieve remission from depression. In a later video, I'll discuss how these lifestyle medicine tenets can help improve depressive symptoms. You want to consider total body wellness to ensure you function optimally, physically and mentally. Subscribe to this channel for more information on mental health. Thanks for watching, and I'll talk to you soon.